Hi everybody, it's Dr. Sherry Caplan from Vitality MD. We're going to be starting a new series of Ask the Doctor on different medical problems. So at the moment I have a few patients who've kind of written a few questions, and so I'm going to tell you about one of them. Is a patient called Julie who's 19 years old who was recently diagnosed with polycystic ovaries and wanted to know how she can sort of treat this holistically. So let's first talk what polycystic ovaries is. So it's kind of a genetic condition that predisposes women to have hormonal imbalances. And what are those imbalances? So essentially there's a imbalance between estrogen and progesterone, where they might have too much estrogen relative to progesterone, and that causes a whole bunch of symptoms. And those symptoms could be, you know, heavy periods or lack of periods, and moody, irritable, PMS, fatigue, and a whole bunch of things, as well as they tend to push a lot of their hormones towards the androgens, so that's testosterone, DHEA, androstenedione, and dihydrotestosterone. So side effects from that can be acne, oily skin, hair loss, or hair where they really don't want it, more in a male pattern situation, as well as there's an insulin resistance component, meaning that they don't manage sugars very well. And the thing is, the more sugars that you eat, it actually kind of pushes everything off towards the androgens and really messes up your hormones. So in conventional medicine, the way they manage it is they actually give you the birth control pill, so that sort of quiescens the ovaries, because in polycystic ovaries what happens because of the hormonal imbalance, or it's kind of the catch-22, does the cyst cause the hormone imbalance or the hormone imbalance cause the cyst? But it's a bit of both. So the birth control pill sort of quiescens the ovaries, and then also the birth control inherently lowers testosterone, and so that helps with their side effects. And then sometimes they'll add in metformin, which is an insulin sensitizer, plus or minus spironolactone to manage the testosterone or androgen excess symptoms. So at Vitality MD, we kind of give patients the whole gamut of what we can treat them with. So we can use some of those conventional treatment options depending on what the patient wishes, but we also can use a very holistic approach, so where you attack nutrition, lifestyle, and supplements. So, you know, the way you eat, so changing how you eat. So if you're eating a lot of bread, pasta, rice, and cakes and cookies, or eating more carbs, or sometimes vegetarians have a lot high carb intake, that actually can sometimes make polycystic ovaries worse and having more androgen side effects. So watching how you eat is important. Certain supplements we will use, so basically about fixing that estrogen progesterone balance. So essentially we want to either get rid of excess estrogen or increase progesterone, and there's many different supplements and nutrients that we can use, and examples is chasteberry, vitamin C, NAC, and also prescribing progesterone, bioidentical progesterone. And then obviously we always talk about exercise and de-stressing, because basically everything is intimately related. So if you're stressed out, not sleeping, not eating right, not exercising, that's going to make things worse for you. And really cleaning up your diet and lifestyle is going to make a huge impact. So come check us out at Vitality MD, where we give you all the options on how to treat polycystic ovaries. Anyways, till next week, it's Vitality MD.